Hi, my name is Justine. I'm a Harper College nursing student, and I'm here to do a head-to-toe assessment on you. Is that okay?
Yes.
Alright, so just to verbalize a few things before we start, I took his vitals. His blood pressure was 117 over 72. His heart rate was 86. His respirations were 15, and his temperature was 98.7, which is all normal. I also assessed his BMI by taking his height and his weight, and we looked at the chart and it was 19, which is normal for his height and weight. And lastly, we assessed the Snellen eye chart, which is visual acuity, which is cranial nerve number 2. And he saw at 20/20, his vision's 20/20, so that means what he saw at 20 feet, the normal I can see at 20 feet. So now I'm going to ask you some questions. Can you tell me your full name and date of birth?
Kevin Michael Hegum, August 18th, 1998.
Okay, and do you know where you're at?
My parents' bedroom.
And do you know why you're here?
For your assessment.
Yes. And do you know what year it is?
2018.
Correct. Alright, so I was assessing his level of consciousness, as well as cognitive function. So your alert and oriented times 4, person, place, time, and situation. His cognitive function is intact because he was accurately answering the questions. His speech and communication are appropriate. He's not talking too fast or too slow. So now to start, I'm going to just start by looking at the head, and we're going to work our way down to your toes. So I'm looking at the size and the shape of the head, noting that it is proportionate to the rest of the body. And then I'm going to palpate the skull. I'm feeling for any bumps, lumps, indentations, depressions, or anything of that source. I'm also looking for any lesions or infestations of the hair, which I do not see. Next, I'm going to palpate the temporomandibular joint. So can you open your mouth, and close, and open, and move side to side? Good. Did you feel any pain?
No.
No? Okay. And I did not hear any crepitations or clicks or cracks. So then I'm going to just look at the face overall. I'm looking for symmetry. I'm looking at the eyebrows, the eyelids, the nasolabial folds, and the corners of the mouth. And note that they are symmetric, which means that cranial nerve number 7 is intact. And then I'm going to press on your sinuses. So you should just feel firm pressure. This is the maxillary sinus and the frontal sinuses. And did you feel any pain at all? No? Okay, good. Then after that, I'm going to start by looking at your eyes. So I'm going to lead you through the 6 cardinal positions of gaze. So just keep your head straight and follow my pen light with your eye. This tests cranial nerves 3, 4, and 6. And also the ocular eye muscles. Good, and then just follow it straight in. Alright, you can look away. So that was also the accommodation test. What I wanted to see there was that the eyes converged symmetrically and the pupils constricted, which they did. So now I'm going to do the pupillary light reflex test. So just look straight ahead for me. And I'm just going to shine this light in your eye. Good. And what I wanted to see there was that the pupils constrict as the light passed through them. And I would document that as perla, which means that the pupils were equal, round, and react to light and accommodation. And then, lastly for the eyes, can you look up for me? I see that the sclera is china white and the conjunctiva is pink, which is normal. So now I'm moving on to the ears. I'm looking at the ears, looking for any lesions, ulcerations, skin conditions, anything of that source which I do not see. And then I'm going to palpate. Do you have any pain? No? Okay, I'm feeling for any lumps, bumps, masses, anything abnormal. I'm also looking in the external auditory meatus for any buildup of cerumen or foreign objects that are not supposed to be there. And then I'm going to perform the whispered voice test, which tests cranial nerve number 8. So I'm going to whisper some things and you just repeat what I say, okay?
Physical assessment.
It's awesome.
Is awesome.
Good. So cranial nerve number 8 is intact, and then I'm going to look at the nose. I'm noting that it is in the correct position. On the face, I'm looking at the skin, seeing for any lesions, ulcerations, vascularity, anything of that source. Then I'm going to palpate. Do you feel any pain?
Nope.
Alright. And then, can you lift your head up for me? and I note that the septum is midline. Okay, you can bring your head down. And then can you plug one nostril for me and breathe in? Good. And plug the other. Good. So I note that the nostrils are patent. So now, moving on to the mouth, I am looking at the lips. I'm noting that they are pink and moist. They're not dry or cracking. Can you open up for me? Alright. I'm looking at the dorsal surface of the tongue, noting that it is rough with papillae. I'm looking at the teeth and the gums, noting that they are present, the gums are not bleeding, and the teeth are not missing or crooked at all. Can you lift up your tongue for me? Looking at the ventral surface of the tongue, you can put it down. Noting that there was veins, and I was looking at the floor of the mouth for any masses or lesions at all, which is a common place for oral cancer. Can you open up again for me? Alright. I'm looking at the buccal mucosa, noting that it is pink and moist. Looking at the roof of the mouth, noting the hard palate is palish with rugae, and the soft palate is pink and moist. Can you stick your tongue out and say ah? Ah. Good. I was looking at the soft palate and the uvula, and when Kevin said ah, they rose, which tests cranial nerves number 9 and 10. I was also noting that the uvula is midline and his tonsils are present. They aren't inflamed or swollen or anything like that. And then can you just stick your tongue out for me and put it back in? Good. So I know that the tongue is midline, which means that cranial nerve number 12 is intact. So now, moving on from there, I'm going to assess your glands. So I'm just looking your parotid glands, your salivary glands, and your thyroid glands. I don't see that they're inflamed at all or swollen, which is normal. They shouldn't be. And then I'm going to assess range of motion of your neck. So can you look up for me and bring your chin to your chest? And then look left and right. Good. And then put your ear to your shoulder and your ear to your shoulder. Good. So then I'm going to palpate for lymph nodes. These are your pre-auricular, post-auricular, your submental, your submandibular, your jugulo-digastric, your superficial cervical, your deep cervical chain, posterior cervical, and occipital. And then can you kind of shrug up a little? And then I'm just feeling for the supraclavicular lymph nodes. I note that I did not feel any that were swollen, which is normal. And then I'm going to feel for your carotid artery. So I'm going to feel one at a time. And I know the rate is within normal limits, the rhythm is regular, and the strength is 2+. And then I'm going to auscultate each artery. Are you doing okay?
Yeah.
Alright. So I'm just going to have you breathe in and out and hold, okay? While I listen. Okay, breathe in and out and hold. Okay? And then breathe in and out and hold. Good. You can breathe normally. So I was listening for any bruit, which is just a swishing sound, which I did not hear, which is normal. You don't want to hear that. And then after that, I'm going to assess the strength of your neck muscles. So can you shrug up against my resistance? Good. And then can you push your face against my hand? Good. And then push your face against my hand. Perfect. So cranial nerve number 11 is intact. So now, I'm going to move on to, where do I go after that? The heart and the neck muscles. Now you can lay down. So, I'm going to have you lay down in a supine position. And can you turn your head off to the left? Okay. So I'm looking right here at the jugular vein, noting that I don't see any bulging of the vein. You don't want to see that. If you did, it would mean that there's increased pressure, and that's not a normal finding. So that looks good. And then I'm going to listen to your heart, so you can just lay down normally. Okay, the heart sounds good. The rate and the rhythm are regular and within normal limits. And then I'm going to listen to all the chambers of your heart. And so just breathe regularly. First I'm going to do it with the diaphragm and then with the bell of my stethoscope. So this is your aortic, pulmonic, tricuspid, and your mitral. Good. And then I'm just going to do the same thing with the bell of my stethoscope, the aortic, pulmonic, tricuspid, and mitral. Good. So I just heard regular S1, S2 sounds. I didn't hear any extra sounds or clicks or murmurs or S3 and S4. So that is all normal. So then I'm going to move on to the abdominal assessment. Yeah, we'll do that. So can you just move your hands off to the side? So I'm just looking at the contour and the symmetry. Couldn't get it out. So I note that the contour is flat, and just going to go over here towards the feet and looking and noting that it is symmetric on both sides. Then I'm going to come back up here and look at the abdomen. I'm looking for any pulsations. I just see regular respirations and a few aortic pulsations, which is normal in skinny people. And then I'm looking at the umbilicus, noting that it is inverted. I don't see any drainage or infection coming out of there. I'm looking at the skin overall. I see some freckles, but none that are like alarming. And then I'm going to listen to the bowel sounds. So you can just breathe regularly, and I'm just going to listen to in all four quadrants. I heard those loud and clear. So now I'm going to listen to the aorta, which is located a couple inches above the umbilicus. And then the renal arteries, which are just off to the side. Okay, so bowel sounds were definitely present. I did not hear a bruit or any sounds coming from the aorta or the renal arteries, which is normal. So now I'm going to begin palpations. So do you have any tender spots of your abdomen at all?
No.
Okay, so I'm beginning light palpations first, which is about 1 centimeter deep. And I'm just feeling for anything abnormal, any lumps, bumps, masses, anything of that sort, which I did not feel. And then I'm going to do deep palpation, which might be a little uncomfortable. It's 5 to 8 centimeters deep. So I apologize. Are you ticklish? Okay. So I'm just feeling around. I don't feel anything abnormal. I just felt a nice soft abdomen, which is normal. So then after that, I'm going to have you sit up, and I'm going to assess your upper extremities. So I'm just looking at your arms, looking at the skin color, noting any erythema, cyanosis, jaundice, or paleness, which I do not see, looking for any lesions, ulcerations, swelling, any edema, anything like that, which I do not see. And then I'm going to assess skin temperature with the backs of my hands all the way down to the fingertips. I note that the skin is warm. I'm looking at the nail beds, which I note are pink. I'm assessing capillary refill, which is less than 2 seconds. Checking the nail bed for any clubbing. So I'm looking at the profile sign, which is less than 160 degrees, which is normal. I'm going to check the same on this side. Capillary refill. Yep, less than 160. And then I'm also going to feel the radial pulses. Okay, and I note that they are symmetric. The rate is within normal limits. The rhythm is regular. And the force is 2+, which is normal. Then I'm going to do some strength exercises. So can you hold your palms up out to the ceiling? Okay, and hold them there. And I'm going to count to 5. 1, 2, 3, 4, 5. Good. And I'm going to note that there was no drooping or sagging of one hand. Can you squeeze my fingers? Okay. Good. He's got good grips in his, yeah. That's, all right. Good. So then can you hold your hands like this? Okay, and can you push? Good. And then pull. Perfect. So he's got good range of motion and strength in his upper extremities. So now, moving on, I'm going to assess your respiratory system. So I'm just looking at your breathing overall, noting the rate, the rhythm, and the depth of your respirations. You appear to be sitting comfortably, not hunched over, struggling to breathe at all. You're not hyperventilating or hypoventilating. I'm looking at the chest, noting that it is symmetric. Breathing in and out is symmetric. And then I'm also looking at the back, noting that there's no discoloration of the back at all. I see you have some freckles, which are normal. And it's important to assess the back because it's hard for the patients to see, so they might have lesion or ulceration that they cannot see. Then after that, I'm going to listen to your breaths. And so for this, I'm going to have you breathe in and out through your mouth a little bit deeper than normal, and I'm going to listen to a full breath in each spot. And if you become dizzy or anything like that, let me know and we'll stop, okay? And in and out. 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 Good. So I know that your anterior breath sounds were clear, so then I'm going to move on to your sides. I'm going to listen to 2 spaces on the left-hand side because there's only 2 lobes, and 3 on the right-hand side. So if you can just lift your arm up for me. And breathe in and out. In and out. Good. In and out. In and out. In and out. Good. And I did it in a triangle pattern. And then, are you still doing okay?
Yeah.
Okay. And can you stand up then and turn around so we can listen to the back? Alright. So just do the same thing. Breathe in and out. 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 Alright, good. Now you can sit down. Still feeling okay?
Yeah.
Alright, so I note that his breath sounds were clear. I did not hear any crackling or signs of fluid in his lungs at all. I heard bronchial breath sounds up here, bronchial vesicular sounds above his sternum, and vesicular sounds all along the periphery, which is normal. So then after that, I'm going to move on to your lower extremities. So you can lay back down for me. Alright, and so what I'm going to do is I'm just going to start by, I hope you don't mind.
Okay.
I'm just looking at the skin overall. Can I take your socks off? Okay.
I'll do it.
The patient has too much feet. So I'm looking at the skin overall, looking for any lesions, ulcerations, discoloration. I'm noting the hair distribution. I don't see any missing patches of hair at all, which is normal. Looking for pretibial edema, which I don't see. Looking for any vascularities or bruising, which I do not see. So then I'm going to assess the skin temperature all the way down the feet to the toes. I note that the skin temperature is warm and the skin is dry. I'm going to assess for pretibial edema by pushing on the bone, which I did not see it. If it was edema, it would go in and then it would like stay down there, but it just snapped right back up. So then I'm going to come down here to the toes. I see my patient has ticklish feet, so I will try my best. I'm just going to feel for pedal pulses. I'm noting the rate, the rhythm, and the force, which is all normal. I'm looking at the toes. The nail beds are pink, and capillary refill is less than 2 seconds, which is normal. And then I'm also going to, since you're so ticklish, you are not going to like this.
Oh God. No.
But, well, first before we do that, I'm going to assess the strength of your feet, okay? So can you push down like you're pushing on a gas pedal? And bring your toes to your nose. Good. And then can you lift your leg up for me? And hold it there? And I'm going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, bring it down. And then lift this leg up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, you can bring it down. And then I'm going to have you bend your knee. Bring it up to your chest. Good. And then can you bring your leg out? Good. And bring it in. Good. And then also, can you lift this leg up and bring it out? Perfect. And put it back in. All right. And do the same thing on this side. Can you bend your knee? And then can you go out and in? Good. And then stick your leg out. And then bring it out to the side. Where are you going with that? There you go. And then go like that, and then bring it back. Perfect. Sorry. Okay, so I note that he has appropriate strength and range of motion in his hips and his lower extremities. And since you're laying down, I'm going to attest the Babinski reflex of the feet. This is part of the neuro exam, and we'll see his reaction. So I note that his toes curled. Okay, you ready? Just one more time. Okay, so his toes curled in, so that is normal. All right, see, you're all done with that now. Okay, so can you sit up for me though? And we're gonna have you sit on the pillow. All right.
Mention anything with tickling my feet.
Sorry about that. So now we are going to start to do the neuro assessment. So I'm just going to have you close your eyes and tell me when you feel me touching you, okay? This is the light touch.
Yep. 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 Yep.
Perfect. Okay, so you can open your eyes. And now we're going to do the test for dull and sharp. So can I see your hand this is what sharp feels like, and this is dull. Okay? So I'm going to do the same thing. You just tell me whether you feel dull or sharp.
Okay. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Oh, sharp. Dull. Sharp.
All right, good. And then we are going to do some cerebellar tests. So can you put your finger on your nose for me? Okay, and then can you touch my finger with that finger?
With this finger?
Yep.
Okay.
And then go back to your nose, and then touch my finger again, and back to your nose, touch my finger, and back to your nose, and touch my finger.
Did I do
Good. Okay, good. And then another test. Can you hold your palms out facing the sky? Okay, and can you bring each finger and touch your thumb individually? Good. All right, perfect. So now I'm going to have you stand up, and can you run your heel down your opposite shin? Take the heel of one leg and
Okay.
rub it down the opposite that shin.
like this?
Yep.
Okay.
And then do the other side. Perfect. All right. And then can you stand and hold your hands out with your palms facing the ground, straight ahead of you? Good. And then close your eyes. And this is the Romberg's test. I'm just checking. I'm going to count to 20 to the wall over there. Just normally walk. Okay. And then can you turn around and walk heel toe back to me?
Like
Heel.
this?
Yep.
That's the sobriety test.
All right, good. So I note that you have a normal gait and you aren't falling over and stumbling over your feet. So now you can sit down, and I'm going to test. I'm going to test your quads, your reflex. I'm doing the reflex test.
Oh, okay.
So can you pull your hands like this?
Work like this.
Or like that. I guess that works too. And I'm just going to hit this. This is just going to have to work because I don't have a little hammer thing. Okay? And I note that his foot moved. Perfect. Alright. And then I'm also going to test your biceps. So just let your arm dangle as much as it can go. Okay, and I note that your fingers moved when I hit your tendon. Good. So I note that the quads and the biceps reflex are intact. And then to finish up the assessment, I'm going to have you stand up for me one more time, and then just stand straight. And I'm looking at the spine. You can turn, there you go. Looking at the spine, noting that the thoracic cage is convex and the lumbar is concave. And then can you just bend over as best you can and touch your toes? Good. Wow, you're flexible. And then I'm looking at the curvature of the spine, noting that it is straight. It is not curving off to the side, which is abnormal. And then you can stand up again. And then I'm going to do some exercises with the spine. So just turn this way, and then can you put your hands on your hip, and then just twist your upper torso that way, and then the other way. Good. And that then concludes the assessment.